Hello and welcome to the Aligned Modern Health Digital Doc Conversation on Pain Management. We are joined today by Dr. Jonathan Kalin, licensed acupuncturist, and Dr. Shane Bruni, chiropractic physician with Aligned Modern Health. Before we turn it over to the team to talk about pain management, we'd just like to briefly introduce Aligned Modern Health in case this is your first time joining one of our Digital Doc webinars. Aligned Modern Health is Chicagoland's top-rated health and wellness service provider in the alternative medicine space. Alternative medicine just means no drugs, no surgery. We take an integrative approach to all of our customized treatment plans, and we really aim to get to the root cause of why our patients are feeling what they are feeling, and not just focusing on one siloed symptom or condition. We fully appreciate that each of our patients are unique individuals with unique concerns, goals, and conditions. Each of our 18 clinic locations around the Chicagoland area are supported by several different core services, including physical medicine, which is supported by chiropractic care, injury prevention techniques, injury rehabilitation, athletic performance support, and clinical massage therapy. Our acupuncture practice can greatly benefit physical pain symptoms, as well as some more intangibles like stress, anxiety, depression, sleeplessness and insomnia, men's and women's health and hormone balancing, fertility and pregnancy support, seasonal allergy support. This practice is also supported by some other modalities under the traditional Chinese medicine umbrella, like custom herbal medicine, cupping, and moxibustion. We round out our services both in clinic and via telemedicine in several US states with our functional medicine and clinical nutrition practice. This practice is a great way to do a deep dive internally to better understand why you feel what you feel externally. We treat a variety of gastrointestinal disorders, autoimmune conditions, bloating, constipation, fatigue, migraines, sleep disorders. We work with food sensitivities, hormone balancing, and men's and women's health, skin, hair, and nail issues. This practice is also supported by nutritional counseling. Aligned Modern Health is in network with most major insurance providers, and we are happy to investigate your benefits if you have questions about what your insurance plan may cover with us. And we also offer free 15-minute consultations in case you have any questions and would like to meet with a provider before a full new patient exam. Speaking of questions, you are very welcome to ask questions of Dr. Kalin and Dr. Bruni about today's content on pain management anytime during the webinar by typing your questions into the Q&A feature on Zoom. The Q&A feature is the little icon with the two conversation bubbles, and you are welcome to type in those questions anytime, and we will address questions at the end of the presentation. All registrants of today's webinar will receive a copy of the recording, so if you miss a little bit at the beginning or you have to hop off early, you will be emailed a copy of the recording early next week. All of this said, it is my pleasure to now introduce Dr. Shane Bruni.
All right, thank you so much, Janine. I'm Dr. Shane Bruni. I'm one of the chiropractors at Aligned Modern Health in Orland Park. I'm very excited to talk about pain and really what I do as a chiropractor day to day. So I graduated from National University of Health Sciences in Lombard, Illinois, currently practicing in Orland Park. I like to describe myself as a rehab chiropractor. So I've always been interested in athletics, physical rehabilitation, physical medicine, exercise science, physical therapy, and of course, chiropractic. So I'm certified in McKenzie Method Parts A through D, which really assesses movement and uses movement to treat pain and injuries. I work with a variety of people, a variety of injuries and pain, but I would say my favorite people to work with would probably be athletes, since that's kind of what I'm into, but I enjoy working with everybody. My favorite patient out of that would probably be golfers and runners. I'm going to go ahead and hand it to Dr. Kalin.
Hello, and thanks again for joining us today on our talk on pain. I'm Dr. Jonathan Kalin. I'm a licensed acupuncturist. I too actually also went to National University, and is also where Dr. Shane and I met. We attended classes together, so we both staffed at our Orland Park Clinic for Aligned Modern Health, and we've honestly had some really good partnerships throughout that time, and some great success stories, which we will talk about later in this conversation as well. I also got my doctorate at Pacific College. It is an additional acupuncture college here, and have some additional postdoctoral work in pain and functional anatomy methods of treating pain and neurological conditions as well. I love treating a lot of chronic pain management, a lot of chronic disease management, dealing with a lot of autoimmune conditions, neuropathies, things like that. But honestly, I'll see anybody for family practice, general medicine as well, any aches and pains that we normally have. Pain, affects us all, and we definitely want to make sure that we're covering all of our bases with that. And for that, I will go to our next phase. Dr. Shane's going to take over, give a little bit of a general overview about what we do and how we coordinate.
All right, thank you so much. I'm going to start with two main things. I want to go over what actually is pain and what do I do as a chiropractor to treat pain. So what is pain? Pain is our internal alarm system. It's our body's way of communicating with us that there's something wrong. Almost like a check engine light on your car or a smoke alarm in your house. When that smoke alarm goes off, it can be telling us a few different things. The first thing is there could be a fire inside. And with our body alarm, when we have pain, it's telling us that there may be tissue damage. So when we first have a fire or tissue damage, the first thing we have to figure out is the extent of that fire or the severity of that tissue damage. So if that fire is able to be put out with a fire extinguisher, some water, a blanket, that's the equivalent to using conservative care. Conservative care meaning a chiropractor like myself or an acupuncturist like Dr. Kalin, maybe a physical therapist to assess the situation and be able to help you with the tissue healing without surgery or medications. Now, if that fire is too large and you need to call the fire department to come over, that would be the equivalent to needing a surgical consultation or needing a pain specialist. Now, I still recommend people start with conservative care, even if they think it's something more serious. Obviously, there's situations, if you have a broken bone and it's sticking out of your shoulder, probably go see urgent care or a surgical specialist. But if it's something where it's just high amounts of pain and you're not really sure, we're able to do a thorough assessment and figure out how severe that injury is. And if it is severe, we have a large network of physicians that we can refer you to. So I always recommend starting with conservative care. And even if you do need surgery, it's been proven that conservative care is great before surgery and after surgery to speed up recovery. Now, the second thing or the second reason that smoke alarm may be going off is there could be smoke in the house. And that smoke could be due to maybe you were cooking in the kitchen and you left something on, or maybe your toddler took one of their little plastic toys and put it in the light bulb and it starts to burn and smoke. I'm talking from personal experience there. And the equivalent to that in the body would be irritation, some type of irritation, whether it be caused by prolonged sitting, repetitive movement, poor posture. These are all things that can cause minor aches and pains, but may lead to actual tissue damage later on. And what I've noticed is most people, when they get these minor aches and pains, they tend to start by taking ibuprofen, Tylenol to mask the pain instead of figuring out the root cause, which is crazy to me because if you had smoke in your house, you're not going to say, I think it'll fix itself. No, you're gonna figure out where the smoke is coming from, and you're gonna stop the root cause of that smoke before it turns into a fire. So in the body, we have to figure out the root cause and stop that irritation before it becomes tissue damage. And the third reason that smoke alarm may be going off is because the smoke alarm may be broken or out of battery, and the equivalent in the body would be lack of sleep, poor diet, poor hydration, high amounts of stress, anxiety, depression. These things all play a major role in contributing to pain. And that's something that we look at as a chiropractor, as an acupuncturist. And as a chiropractor, like I said, I treat various conditions, anything from low back pain to headaches to shoulder, knees, hips, hands, a little bit of everything using three main treatment components. The first thing is the chiropractic adjustment. With the adjustment, we're finding areas in the spine or extremity that may be restricted, and we're adding a small amount of force to get movement in that area, whether it be a mobilization or a small thrust. And once we get that movement, it could do a few different things. It can increase mobility, decrease pain through endorphin release, and it can increase the overall efficiency of the nervous system and the entire body. The second thing is manual therapy or massage therapy. Manual therapy, we're looking for areas of muscle or fascia that might be tight, causing discomfort, imbalance in the body, and we're trying to relieve that tension in the muscle and fascia. And then the third thing is corrective exercise. And I can't stress how important corrective exercise is, especially in long-term success, because we're able to teach you the exercises in the office, but you're also able to do those exercises at home, which you should be doing the exercises at home as well, because you're not only getting better here when we're with you, but that'll give you the chance to get better at home yourself. And that's going to help with that long-term success. With a thorough assessment, we're able to figure out areas of your body that may be weak and need more stability and strength. And then we're able to figure out areas of your body that may be tight and restricted, that needs more mobility and flexibility. And that'll allow us to rebuild or restore that balance through the body. And then just like Janine talked about, Align Modern Health really is amazing because we have so many different professionals in one building. We have a chiropractor, acupuncturist, functional medicine doctor, massage therapist, nutritionist, rehab specialist. So we're really a one-stop shop for all your health and wellness needs. And we're lucky enough to have Dr. Kalin with us today, who's an amazing acupuncturist, and he's going to give his take on pain and what he does for pain and injury.
All right, thanks so much, Dr. Bruni. Again, thanks and welcome for joining us today. I'd like to talk a little bit about pain, go over just some theories and ideas about pain as a whole. We'll start first by giving some technical aspects, but don't worry, we're not going to like throw an entire school lesson at you or anything like that today. So one of the first things we're going to talk about is pain gate theory. The idea is, yes, smack your arm, we have some pain there, makes sense. Obviously, and generally when we are hurt, we tend to grasp the limb or the area that's been hurt. We massage it, or when we're younger, the mother, kisses the boo-boo, and that helps us feel better. The idea is there is a competing signal that interferes with that initial pain signal. So in a way that competing pain signal or competing non-noxious stimulus allows us to not feel that pain. This can be activated by a lot of different ways. Soft tissue massage work, exercising. Not only are we producing additional stimulus to our body through exercise, we're also naturally producing endorphins in our body as well, some of those natural painkillers. So also you can do so by hot and cold therapy, again, the relaxed and cold, helping for promoting blood circulation, cold helping with reducing the inflammation in the body. So we're activating a similar network in many different ways. Acupuncture as a whole accesses some of these networks by small filiform, super tiny needles, smaller than a human hair. Most people think, needles, but more than 20 of these can basically fit into what we normally associate with a needle. You barely feel a thing. And the idea is we're promoting blood circulation, we're relaxing muscle tissues, we're activating fascia, Now, fascia is this big, huge, hot topic in all things neuromuscular these days. What it is connective tissue between the skin and the muscle that can get tight, bound up. That sense of achy soreness that we might have, that we can go, is that my back? Is my knee? Something just doesn't feel right. Often that is this connective tissue that again wraps everything, that can get tight and glued into place. If you've ever had a massage and you feel those little pops and cracks, those are called fascial adhesions. That's where that fascia is glued into place and things get stuck. Reduced range of motion, even if the joint itself is perfectly fine. Again, that's some of the benefits of coming in and seeing complementary and alternative medicine, is they can do like a full scope, full intake with you to figure out what is exactly going on and what exactly is the root cause, and building a unique treatment plan for you with that. For myself, often, obviously, pain is going to have all numerous different causes. We've got nerve-based pain. We've got, as Dr. Bruni said, it's a fire. You have actual tissue damage, or you've got smoke, which is just generalized inflammation. The check engine light versus my car actually just shut down aspect. And then, of course, back to the idea of batteries or wiring. Something's wrong with the smoke detector. That's a big, those intangibles, that aspect of acupuncture being very helpful. We're working with those intangibles like stress. We're down regulating a lot of that fight or flight response. We are getting into rest and digest. Normally, we're a little bit more receptive to things. We're not super tense. That tension itself can make us more perceptive towards pain in our body. So even that tension can make pain worse as well. Kind of the idea is essentially just like that pain gate theory, where there's competing signals and things like that. When we're in that super aggressive, anxious state, our perception is wider, looking for any sense of danger. So everything is wired to be stronger. So even something that would normally be, you wouldn't even notice by bonking your knee or thigh or anything like that, it would be immediately like, I just got hit by a baseball or something to that effect. And sometimes that perception aspect is why pain is both an actual noxious stimulus, but also perceptive in the head. It is this two-way street, and that can be modulated. And again, that's a great part about acupuncture as a whole, complementary medicine, working with a chiropractor and acupuncturist together to fit your unique needs with that. Now, also speaking about over-the-counter pain medication in general to help our body, using that to mask those symptoms. We want to make sure we're addressing the elephant in the room, the opioid epidemic that's been going on. There's been some good takeaways because of that. With all that data that came with that, and we figured out that maybe this isn't the best route to go. Individuals in places like the VA created programs with partnerships and with community providers out in the world to allow people, vets and other things like that, who are experiencing their pain, to try some of these other modalities first. It is now beginning, because of this opioid epidemic, we're saying, let's try some of these other methods before just masking the symptoms. And honestly, we've been getting some great results. I honestly see quite a few VA and vets in my practice, and honestly have some really good success stories myself. You guys have any questions about specific things, we can then also talk about that at the end as well. Dr. Shane, Dr. Bruni, and myself also coordinate on a lot of different patient cases. And honestly, we really get the best possible results working together, where we coordinate, put our heads together, build some of those treatment plans, me focusing a little bit more on some of the soft tissue, the intangibles, making sure nerve signals are working properly throughout the body and from point A to point B. And Dr. Shane Bruni not only working to relieve some of the compression on these nerve bundles and fibers, working to relieve muscle tension, doing a functional range of motion and assessment to figure out what are we doing on a normal basis that might be causing these aches or pains. And then also following it up again, as you said, with the rehab and exercise component, because our ultimate idea is to give you the power and knowledge so that you can take care of a lot of things on your own and then tell everybody else. Our idea is no one wants to go to the doctors every day forever. there's an educational component. We are here to support you through this process and after. And for that, we're also going to talk about some of our success stories together, and I'll let Dr. Bruni take the reins on that to start.
Yeah, so just like Dr. Kalen said, it's best when paired together. When we throw chiropractic and acupuncture in at the same time, we see some great results. And we just had a recent patient. I was seeing her. She's a mail carrier, and she had a various amount of issues, but the main thing was pain in her left upper back that would radiate all the way down her arm into her pinky finger. She did a lot of carrying mail, and that would set off the pain, and it was pretty intense for a while. I was treating her for, it was probably close to 4 weeks, and she'd get better for a little bit, and then it would act up again, and she'd get better for a little bit. And I noticed that it was just too inflamed to do too much movement in the area, and that acupuncture would be really great at reducing some of that inflammation. And I sent her over to Dr. Kalen, and yeah, you could take it from here and kind of talk about what you did and what helped.
Yeah, absolutely. And a lot of this, again, comes from this partnership and the fact that we're all in-house working at these cases together. Dr. Bruni had gotten some great results, but was hitting some plateaus. I started treating to kind of help out, also kind of hitting some plateaus. So we kind of took an assessment. We both were out in our front in our whole rehab bay, taking a look at some of these functional range of movements and seeing what areas, what movements were eliciting the exact pain that she was feeling. And with that partnership together, we were able to really narrow down the root cause for that, which informed my treatment and using a combination of acupuncture, TENS unit therapy, that's electrical stimulation, which helps to rehab both nerve and muscle tissue. We were able to knock it out, honestly, within a matter of a couple of weeks after that. Originally, she was set to have like a pain management specialist. We just weren't making the goals that we were expected and that we normally see. But with that pairing and that working together, she's at the point where she's now more or less in wellness, and now in that stage of let's optimize care versus just acute pain management.
Absolutely, yeah. And the key is with this specific case was once that pain was reduced, for me, it allowed me to be able to do more adjusting. There was more movement with adjustments. There was more, we were able to get deeper with the deep tissue massage and manual therapy. We were able to get further along with the rehab exercises. So acupuncture and chiropractic really do play off each other. And once we had that pain relief, it was just boom. Now we just took off and she got so much better. And then there's another patient that we did co-treat as well. And I do see the questions come in, and I think we'll get to these in just a little bit here. So this patient was a VA patient, and she came in to me initially for low back pain, neck pain, and headaches. And she actually responded really well, really quickly with the headaches and neck pain. Those went away very fast, but the low back pain kind of lingered. And we only did chiropractic just because that's what the VA allowed for. And then after the chiropractic, we were able to add more acupuncture visits. So the neck pain, headaches resolved, but there's still some like lingering issues here and there for the low back. And then she went to Dr. Kalen, and then I think pretty much same thing, right?
Yeah, pretty much. Again, kind of figuring out some of these functional anatomy chains and connective tissue, how all that fires and works together, and kind of noticing some of these limitations around like the hip and the low back. And again, having classes of very intensive anatomy that Dr. Shane Bruni and I can also speak to, kind of figuring out that there were some impingements along that hip, and kind of posturally correcting these with some bolsters, combination of acupuncture, soft tissue, some of that cupping work that we're talking about to help with that fascia, realign again some of those compressions, knocked it out. It was also a really good case. And from that, we're going to go ahead and take some time here and answer a few of your questions. If you guys continue to have questions, we will stay on a little bit longer as well. We are here to help you guys the best we can.
Excellent. Thank you so much, Dr. Kalin. Thank you, Dr. Bruni. That was a great overview and insight kind of into pain, how it manifests, and kind of what we can do from an alternative or conservative approach to care. Thank you so much. We do have questions rolling in. We actually absolutely encourage you to keep typing them into the Q&A feature of Zoom. As those are coming in, a reminder that you are also welcome to a custom personalized 15-minute consult with either of these docs or any of our providers at Aligned Modern Health. This is a great way to get questions answered that you may be more comfortable asking in a private one-on-one setting, and or potentially doing a little bit of an injury screen if you are experiencing acute or chronic pain. You can request this or any more information about your insurance plans by giving us a call at 773-692-6700, or you can visit us online at alignedmodernhealth.com. So the questions rolling in here, very understandably, are pretty specific and personal to each of the folks asking the question. So again, at some point, it may be more medically appropriate to speak with these folks one-on-one in something like a free consult or injury screen. But for the best we can, kind of for a group audience, we'll try to maybe generalize these just a little bit to keep it appropriate again for a group. But please, if you do have very specific questions, you are welcome to reach out to us directly. So a question for the both of you. I love both of you to answer. We work a lot with disc herniations, and a question came in specifically about disc herniation. A lot of times the kind of standard chiropractic adjustment may or may not be appropriate. Surgery may or may not be appropriate. What are things that we can suggest or do to help with a multi-year battle of pain due to specifically known disc herniation? Dr. Bruni, would you like to start?
Yeah, sure. So I saw that question here. So a 4-year battle. First of all, sorry that you've been dealing with that for so long. Let me take a look at the question. So disc herniations, that's something we deal with here on a daily basis. It really depends on the specific case, but what I do, it depends on the severity of the disc herniation. If it's still very acute and painful, we probably want to avoid adjusting for the time being and use more of the conservative therapies. But we're still able to do a ton with that. And through a thorough assessment and movement screen, we're able to figure out if there's any movements that help recentrate that disc or figure out what is the root cause of that disc pain. And we're able to do certain exercises and soft tissue to ease that tension. And if anybody's dealing with that disc pain, especially if it's been going on for 4 years, I challenge you to make it in here. That way we could do a thorough assessment and help you out. Dr. Kalin, you could go ahead and give your take on that.
Oh, absolutely. And yeah, honestly, disc herniations are cases we see literally every single day. He and I co-treat on quite a few of those. Generally, from an acupuncture standpoint, what I would do is to help with the perception of the pain, getting those pain scores down, getting the tissue a little bit more relaxed. If we're having any like radiating numbness or anything like that down like the leg from that disc herniation, we're wanting to make sure that signal is all running smoothly. What happens is when those nerves get compressed, everything basically goes up to 11. Those alarm bells are going off. It's like a super smoke alarm is essentially going off. The idea is we're trying to calm that down just enough so that some of these corrective exercises and adjustments can take hold in an even better way.
Thank you so much. That's really an important point, Dr. Kalin. Thank you for that. We have a couple of questions here that surround the feet. And I think it's widely understood that acupuncture is absolutely a whole body approach that can treat all systems and areas of the body. And it's a misconception, I think, a lot of times that chiropractic is only about the spine. So this is a great opportunity to remind everybody that chiropractic is also a whole body approach, extremities included. A couple of questions here. I'd love to bring to you both. Maybe something a little bit more chronic, like arthritic pain in the feet, and then also something potentially more acute, like heel pain or foot pain, as if somebody were stepping on a stone. Very different things, but can you speak to, is alternative medicine appropriate for situations like this? And, are there things that we can do to help? Dr. Keelan, would you like to start this time?
Yeah, absolutely. And to be honest, we see a lot of foot and ankle pain a lot. For the first couple of years, because I've been with Lion for about 2.5 years at this point, I staffed our South Loop clinic, so I had the opportunity and to treat a lot of Chicago Marathon runners and people gearing up to train. So we saw a lot of foot, ankle, leg issues all throughout the body as well. But I definitely want to highlight some of the cases of like plantar fasciitis, this chronic inflammation in the foot, and often presenting is also some of this heel pain that we might experience as well. I've gotten really, really good results with a combination of liniments, topicals, soft tissue massage work, also working to relax some of the really deep internal musculature, because the foot is composed of 1,000,001 different joints, and each one of those has like muscles, tendons, ligaments attached, and all of that can have dysfunction anywhere, and that can potentially contribute to some of these pain you're experiencing. And getting some of those aligned properly, making sure everything gets relaxed, that we're getting proper blood flow to this area, is going to help with that tissue recovery and healing process. And I'll let Dr. Shane take his spin on that.
Well, that's actually a great question, because we're currently co-treating a patient that has heel pain in both heels, and so this is great. The foot is so important. The foot is really your foundation. It's your connection with the ground, and people with foot pain know how debilitating it can be. And I guess the point I want to make about the foot is oftentimes the issue isn't primarily in the foot. Sometimes it can start in the spine. Sometimes it could be due to hip or pelvis position being slightly off, or sometimes hip weakness. So while you may feel the pain in the foot, sometimes it's not the root cause. And that's something that we have to look at as well. But when going into the foot specifically, there's so many different avenues that we could go down. We could talk about shoe wear. Are you wearing the correct shoes or orthotics designed for your individual foot? What are you doing on a day-to-day basis to not only relieve the pain, but also strengthen the joints and muscles around the foot? And then, like I said, going into the core, the spine, and the hips, these all play a role in the foot, and it can be really complicated. But for now, on your own, let's see the specific case here.
Oh, just a reminder, it was a question about arthritis in the foot and or acute
Arthritis
heel
in the
pain.
foot.
Mhm.
Gotcha. I'll leave it at that for now without going into specifics, just because there's so many different things that could go into the foot there.
Yeah, absolutely. And that's totally fair. We do have time for one more question. And I think this one's a really interesting one that I am so glad that somebody asked. In your line of opinion or judgment or experience, is anyone ever truly pain-free? And is it possible to be pain-free, or is that a cross that we all must bear? Dr. Keelan, would you like to start?
Yeah, that's honestly a lovely question, and it's pain. We experience it. It's something that's going to happen throughout our lives. It is possible that you can injure yourself later. Pain is an indicator. We want that check engine light to be there. But can we get to a point where we're not suffering chronic pain? Absolutely. That's definitely one of the things and kind of the approach that we like to take. Also, to bring in my own case into this as well. During medical school, right when I started, I actually suffered a big collision, T-boned by a car, had whiplash, a lot of lower back pain. Honestly, it was through some of the benefits that I had from chiropractic care, from rehab. I don't have back pain. So the answer is yes. Can you have some disc herniations and recover from that? yes. I mean, a lot of that's going to depend upon the severity of your case, but with conservative care methods, drugs, surgery, and things like that is something that you can absolutely have as a later in your back pocket. Let's start with some conservative care methods and get some quality of life for you now.
Dr. Bruni, do you agree? Is pain-free an option for folks when thinking about chronic pain or pain management situations?
Yeah, that's a great question. So it's always an option, but I like to think about that statement a little bit differently, where I feel like, yeah, everybody wants to be pain free, and we all want to take shortcuts to being pain free. But I think the better question is, um, what can I do to like pick up the skill and get better at managing my symptoms? Um, and not even really thinking about being pain free. If you're doing the right things and you're working hard at fixing the root cause of the issue instead of just being constantly in that mindset of, I want to get rid of the pain, I want to get rid of the pain. That's the better mindset that you want to have, because just like Dr. Kalin said, pain is not a bad thing. It's not necessarily a good thing either. It just is what it is. It's communication. Our body's trying to tell us something, and if we're telling it to shut up constantly, we're kind of disrespecting that alarm system. We want to honor that communication by trying to fix the root cause.
Thank you so much. We really appreciate your time and your wisdom on this webinar today. And thank you to all of you that have joined us live and all of you that are watching the recording. We really appreciate your time and we hope you found this beneficial. Our next Aligned Modern Health Digital Doc webinar is coming up on Thursday, July 11th, and the topic is stress and stress management. We will go through an idea of what stress is, how it manifests in our body, and some specific tips and tricks we can do to mitigate stress from our lives. Similar to pain, it may present, throughout our lives, but there are things we can do to help us through. So if you are interested in registering for stress and stress management on Thursday, July 11th, or at least ensuring a copy of the recording, you may register online at alignedmodernhealth.com. Thank you so much for joining us today. This does bring us to the conclusion of today's webinar on pain management. Dr. Kalin, Dr. Bruni, thank you. And again, thank you to all of you that have joined. Have a great day. Cheers.